been using factors that predict, obviously not very accurately, who, quote, should and should not be forming dangerous arterial plaque, rather than looking to see who actually does and does not form plaque. And that information is not hard to get. At ProActive, we think it's time to look.
They feel like they're in good hands. They feel very comfortable. Really enjoy it. They like the lounge. They like the attention that they're given, how quickly we respond to their phone calls.
It's rewarding to make a patient feel comfortable.
Cardiovascular disease, as you know, has been the #1 killer in America almost every year for the last 100 years. And for the last 15 or 20 years, it's been demonstrated in any number of studies that if we reduce cholesterol levels, LDL or bad cholesterol levels in particular, we can reduce that risk. The real issue was choosing who needs treatment. It's not reasonable to treat everybody, but we do need, I think we have an obligation to treat people who are at risk for having a heart attack or stroke. The standard of care has been to assume that people are at risk based on their smoking history, their blood pressure, and their cholesterol. But this doesn't work, and the evidence for that is that more than half the people who have heart attacks were not considered to be at high risk, and we missed an opportunity to prevent their first event. It's our position at ProActive that we should not miss that opportunity any longer. Knowing who's forming plaque, knowing who's at risk for a stroke or heart attack, is not that difficult, and we don't have to assume people's risk based on those, quote, risk factors. There are simple, non-invasive tests that we can utilize to determine who's forming plaque and who's at risk for having a heart disease. So it became clear to me several years ago that we needed a program where we would identify people who were at risk and do it accurately, where we would treat their cholesterol aggressively if they were at risk. And then, since most patients who need cholesterol management are lost to follow-up and not treated to goal, we needed a program that would embrace that relationship and make it possible for patients to get the follow-up that they've needed in order to assure that their risk factors are modified effectively. So we've combined two things. We've taken a cardiovascular prevention attitude where we look for plaque, we look to see who's actually at risk and not assume who's at risk. We look for any opportunity to intervene and reduce that risk. And we've combined that with concierge care where patients have virtual, immediate, and unlimited access to their physician, and we can stay on top of everything that it takes to keep them at lower risk.
I always try to think of a patient as a family member of mine. I wouldn't want them to walk away disappointed or not getting as good a care as they should, and unfortunately nowadays with healthcare and everything that's going on with it, patients are not receiving that kind of care from their physicians, and we're still able to provide that.
Well, I always feel like I'm able to comfort them, but yeah, with this ProActive, I think that's a great thing, especially, I mean, I know what we're gearing towards with the ProActive, we like to get into even a younger population for preventative care, but for the elder patients, you know, like if it was my great-grandmother, my grandfather, I love that fact because some of them are in their late 80s, early 90s, and they don't have family here. What do they do? Who do they call on? Who do they count on? They count on us. And that, to me, is a very rewarding thing, knowing that this little old man or this little old lady doesn't have to worry.
At ProActive, we've combined concierge medical care and cardiovascular disease prevention. The first step is surveillance. We look for plaque using simple, non-invasive, easy-to-do procedures. Then we look for opportunities to stabilize the plaque. This might be lipid reduction with medication, identifying lipid particle size and optimizing that, looking for ways of reducing inflammation within the vessel. Secondly, we involve ourselves with an aggressive multimodality treatment that may involve medication and certainly will involve diet, exercise, and lifestyle issues. Thirdly, we maintain vigilance. We give patients in ProActive priority appointments. We have a special concierge dedicated to assist in scheduling laboratory studies and imaging appointments and consultations with other physicians when necessary to make sure that these get taken care of at patients' convenience. We post, with patients' permission, medical information to a secure, encrypted website so they have access to their own healthcare documents 24 hours a day, 7 days a week from anywhere in the world. And we provide 24/7 availability to our patients. And finally, and most importantly, we act as patients' advocates. We'll act as your primary internist or with your primary internist if you have one that you like. We'll make your appointments for you and help you with your scheduling. We'll make referrals to other doctors and hospitals where needed, even at a distance. In short, we'll do everything we can to help you navigate through the healthcare system.
Patients come into my office, they sit down, I will contact any doctors that Dr. Ornberg refers them to, set up their appointments. They're used to using our number and knowing that somebody is always here to answer their phone calls.
Here's a brief clip of what actually happens when a coronary artery ruptures. Here's an artery in cross-section with blood supply. Here's a plaque forming within the wall, just as I showed you. And with time, this plaque will enlarge and the wall will rupture, releasing contents of the plaque into the bloodstream, closing off the blood supply, allowing no further blood to get to the heart muscle, and causing a fatal arrhythmia and death. This is what we're trying to prevent with this program.
We're their family, we're their adopted family. We are their family. We have become their family, and we look after them.